Good afternoon, good morning, good evening, Solve community. This is Pradeep, and I am really looking forward to the session today, and I hope you are as well. We're going to talk about the asset pool structure of the Real DeFi for Healthcare project and the decentralized autonomous organization that is being designed for the benefit of healthcare improvement in patients and doctors worldwide. We've already had a session last week or earlier this week introducing you to this concept, but today we're going to dive much deeper into one of the core pillars of this DAO, the decentralized autonomous organization. And the topic today is asset pools and how they are created, how they are governed, how they are instantiated, how they are measured, and how they are redeemed. And this is really fascinating because in my mind, what we have designed here that you will inherit and manage is the idea of a merit-based project financing model. We are in effect looking at a much more empirical, data-driven management system for lending solutions and for financing solutions that could be properly applied in any industry. Our focus is healthcare, and we will focus on healthcare as long as Solve.Care and other entities are involved. We certainly will always keep our eyes on what healthcare needs are. And believe me, there are lots of needs in healthcare that could be met with a decentralized finance solution that is compliant, sustainable, and properly governed. Those are the foundations of doing and designing this decentralized autonomous organization and turning it over to all of you to manage. But the foundation of this DAO is an asset pool. And how that asset pool is conceived and evaluated and organized and approved, and operates and then ultimately generates value for everyone is the foundation. So today we have a lot of material to cover. 1 hour may not be enough, but I want to get us started right away. So let's get into it. So here we are. I think you can see this. So today the conversation is about asset pools. And again, I want you to understand that what we are trying to do here is to really design a framework that will allow for a community-approved, community-governed, community-funded asset pools that address the needs of patients and doctors around the world. This is a true DAO that is implementing merit-based projects. So certainly there are simple lending solutions that can allow various types of instant asset collateral-based lending. And there is a lot of them and they are growing, and that's great for the community. But what I'm looking to do here with the team at Solve.Care and with the founding committee of the DAO is to take it a lot further, a big step towards bringing such a solution to the real world, and to bring a real world solution to market, and to have a community approved, community governed, community funded asset pools that actually can be used in the real world to solve real problems such as healthcare needs of doctors and patients. That's a whole different game. And that's what we're after, is to enable the continuous improvement of healthcare and the continuous improvement of healthcare outcomes by applying decentralized finance in a way that could scale globally. So this is foundational. So let's get into it. So what is an asset pool used for? In the DAO model that we are looking at, each pool must be designed to generate real and sustainable returns, but it should also deliver a tangible, measurable product or service to the healthcare community. And the focus is always on the patient and improving outcomes for the patient. Always, that's the underlying principle. But the pools can be designed to either offer products and services, essentially financing for products and services, or the pool can be designed to underwrite risk. And they're very different pools represented by color. In one case, we are delivering a tangible product or service. In the other case, the DAO is sponsoring risk management. And the pool purpose will design the pool structure. But both pools are possible, and additional pool types will be created by the community, I'm sure. But this is a great place to start with the first version of the DAO implementing a product and services pool. You can think of it as a financing pool, or an underwriting and risk management pool, which essentially is a risk coverage pool, okay? Now, I've given you some examples here of the type of pools you could put in the green or the red pool type. A financing pool could support consumer medical device financing for patients or doctors. It could support a professional medical device financing for X-ray machines and CT scans and even hospital beds and operating room equipment, or even construction of new community care centers or construction of large hospitals where such need exists. Another pool of the similar product and service would be a physician services pool, which essentially gives small and independent physicians and clinics accounts receivable lending or invoice factoring. And I've just given you an idea here as to how you could structure as a community different pool constructs, different annual percentage yields, different level of income share, which we will discuss in a few minutes, different levels of commitment from the asset contributor to the pool, how long their assets need to be committed to the pool. Could be 3 months, could be 12 months, could be 24 months. Let the community decide based on the purpose of the pool. Or you could create an asset pool that is specifically focused on underwriting risk. So in this case, the red box, the physician practice insurance, which essentially could be a pool that allows for underwriting risk for physician practice, malpractice claims, if you will. And in the world of post-COVID world, with all the focus on telehealth and telemedicine, there is huge opportunity there in terms of providing insurance products to telehealth providers who do not have necessarily a robust set of insurance offerings to cover telepractice. So opportunities abound in healthcare. I've just identified a few of them. There are many, many more. The point here that I want you to understand, though, is the pool construct, the pool structure, the pool configuration depends upon the purpose of the pool, and the community determines the pool purpose and the pool structure. So it does require very carefully thought through community governance model, and we'll talk about that in a minute. So not only do you determine what structure the pool has and what its attributes are, it also determines what type of assets can the pool accept. Now, if you're looking at creating a product and services pool, then it is logical to assume that the assets contributed into the pool would have to be liquidated to offer those products and services. Whether you're financing the building of a hospital, or you're financing the buying of an X-ray machine, or you are financing the accounts receivable of a doctor's from the government, you would need to have the assets of a nature that can be easily and quickly liquidated without impacting the underlying value of the pool. So therefore, stable coins would make a lot of sense for a pool type like that. You could configure any coin type, but stable coins would make sense because you need to be able to liquidate and buy back the inherent assets of the pool in terms of without impacting the market or the liquidity or the underlying asset value. Now, if you're looking at long-term risk management pools where you are essentially holding assets in reserve, and those assets could even be reinsured by reinsurance service providers, in that case, the reserve holding requirements could be met by any number of coins. It could be stable coins and or a combination of other coins that the community sees as a leverage or as a value creator. Because in that sense, the only criteria here for this red pool type is to make sure there are enough reserves at all points and that there is enough diversification of asset types to prevent from a significant reduction in the reserve pool value. Otherwise, it's up to you what asset pools you want to support, what asset types you want to support in the risk management pool. The point I'm trying to make here is that the community determines the pool purpose, the pool configuration, and the pool asset contribution constraints. And your governance vote determines what is a pool's actual behavior, both in terms of contribution, distribution, income, interest, and redemption, all of the above. And this ability to create very purpose-built pools that can deal with complex project and real-world needs of real-world people, pharmacies, hospitals, clinics, even governments, communities that want to finance healthcare projects, that subject to community approval could bring an equitable, accessible healthcare to all. This is terribly exciting. This is fantastic. It's up to you to govern it properly, but the model is incredibly encouraging. So this is the framework that the founding committee has been spending months on, and we're just getting started. As we go through this deck, you will see how much thought and energy and effort has gone into designing what I consider probably the most mature project financing protocol the world has ever seen. Let's move forward. Now, what kind of an income could an asset pool generate? Well, it goes to logic that each pool will have a certain type of income based on the asset contributed, the duration of the contribution, and the annual percentage yield expressed in the form of a fixed interest rate. So that is something that the pool contributor should be able to count on and rely upon as the minimum return. Then you could also, and we recommend that you do, consider the pool contributor, the asset contributor, also sharing in the variable element of the pool, which is the income the pool generates net of interest. Having paid the fixed interest on the left and having paid out all the community expenses and having paid out the necessary taxes and so on, there may be, and there should be, a pool income. And you could then distribute that pool income to a variety of parties. Certainly one of them would be the asset contributor, thereby giving the asset contributor both a return that they can count on, the fixed interest rate, and a return they would contribute towards achieving the variable pool income by promoting the pool, by governing and managing the pool properly, by ensuring that the pool is being utilized for its true intent and purpose, by doing what they can to ensure that the pool's purpose is being met, both in terms of communication, in terms of governance, oversight, measurement. So by giving the asset pool contributor a variable piece, engages the community. And our whole notion of decentralization is that the community as a whole, no matter what role they're playing, the governor role or the contributor role or the distributor role, are all incentivized and aligned in the same way. So our view, the founding committee's view, is that pool definition, pool income sharing should be included as a standard template. Of course, you can set the percentage of pool income sharing to what you want, but in the standard schema of a pool, income sharing is a standard feature. Now, I wanted to show you what a pool looks like from an architectural and schema perspective. We use the term scheme to imply a set of smart contracts that perform a very specific function or set of functions that serve a very specific governance purpose. So if you think of the asset pool represented by APX, and since you can create multiple pools, you'll have an APY and an APZ and an AP1 and an AP99. The asset pools each will have the same structure. The first left-hand side is the core schemas, how a pool is proposed, how a pool is reviewed and approved, and how a pool is then automatically instantiated or configured, comes to life. And those schemas are very well thought through set of contracts that allow a proposer, be it community or a distributor or an end client, to propose a pool that serves a need. And as an example, just to illustrate the point, Solve.Care has proposed a pool for consumer medical device financing. And that proposal is the basis for designing the template, the illustrations and the examples we are using. It's just a proposal. It's not been reviewed or approved by the community. But the point is, all such proposals will be reviewed and approved by you. And if you don't like the proposal, you vote against it. And that's the way this DAO is supposed to operate and will operate. So the proposal schema allows for and requires a certain set of configuration parameters, pool parameters, to be submitted as part of the proposal, along with certain staking of tokens, which then ensures to us that the proposal is well thought through. And if the proposal is not accepted, there is a certain loss of those tokens because the proposal was incomplete or was simply not credible. So to avoid the proposal in us being inundated with improper proposals, the DAO can set a minimum proposal staking threshold. The proposal is fed into a smart contract, which does the analysis to determine if the pool meets the constitutional objectives, which we will talk about in an upcoming chapter. And once the proposal has passed the first review by the contract, it goes to review by a number of entities which can be turned on, such as the community governance committee or even community experts, but before it hits the community for a vote. So that proposal can go directly from automatic evaluation to a vote, or it can go through a community review, depending on the complexity. And once it is put to the community approves it or not. If the community approves it, those parameters as a package are fed into a configuration smart contract that activates the pool immediately or on the set date. And the pool is now active. So now you have a PITx pool, which has very clearly defined parameters. There are over 24 of those parameters in terms of contribution period, in terms of what type of assets can be contributed, what's the APY, what's the lockup period, what's the first redemption rights, what are the on income sharing percentage, and so on and so forth. What is the collateral requirements for distributors, and so on. So those configuration parameters are instantiate a pool, but the evaluation and the configuration is automatic. The approval is by the community vote, which is you. Now, once the pool is configured, it is operational, then there are additional contracts that kick in. There's a contribution contract, there's a distribution contract, there's a redemption contract, and there's a liquidation contract to put things in understandable construct. There are certainly more involved functionality than that, but these are the primary functional areas: contributions, distributions, redemptions, and liquidations. Each of these contracts are specifically designed to permit and act upon the configurations that were fed into the configuration contract. So a contribution contract permits contributions to occur in certain whitelisted asset types and allows those contributions to occur for a certain period of time. Distributions contract checks for collateral availability before and calculate the value of the collateral before it will allow further distribution from the pool. The redemption contract allows the pool asset contributors on a certain date or beyond a certain date, past the lockup period, redeem their principal and or accrued interest and share of income. And liquidation contract is when the pool is being dissolved because it has met its objective or it needs to be dissolved for other reasons. So that's clear. Now let's talk about the most exciting part of the pool, and that's the measurement. And this is absolutely fantastic, and I am incredibly excited about what this means. So there are 3 parts of measurement of a pool that are all incredibly innovative and that I have not seen anything like this before. The only example I can come up with is when I was studying the Synthetics product and the Synthetics protocol, and I saw how the synthetic tokens are generated. That was inspirational, but we have created a far more intelligent pool-specific token called pool index token. And for every pool, APX, there is a PITx. The pool index token X represents the accumulated and anticipated value of the pool at redemption time. So the PITx token is a multi-purpose token that is essentially a measure of the pool. It is a direct proportion to the assets that were contributed. It is measuring the value of the pool, it's measuring the performance of the pool and assigning a value to the PITx token that is calculated based on actual pool performance. This is not speculative value, it's absolutely empirically calculated value. But there are parts of this value calculation that require certain amount of logic and certain amount of community agreement on how well is this pool really performing. And that is a function of a pool oracle. So for every pool, there is a pool-specific oracle, which are essentially standard oracles, but they use the configuration parameters of the pool. So you have a pool oracle X, which is tracking the actual performance of the pool against the anticipated baseline performance of the pool. And that then allows us to measure, is the pool performing above baseline or below baseline? And that ends up reflected in the risk-adjusted value of the pool, which then ends up being reflected in the PITx value. So if the pool is doing better than we anticipated, then the PITx will be assigned a higher value. And if the pool is trading below anticipation in terms of risk or defaults or whatnot, then the value will be trending. So it'll be very easy for the asset contributors with a single glance to be able to understand how is their investment in the asset pool doing, and to compare their investment in different pools by simply comparing performance of PITx over a time scale. This is an amazing option because it also gives us a tool that gives the pool contributors the ability to do forward and backward discounting, as well as to assign a certain level of risk. So the combination of the PITx and Pool Oracle creates these pools at a level of sophistication in the DeFi world that we have not yet encountered anywhere else. And I'm incredibly excited about this combination, and more to come on that in a second. So what is an asset pool oracle? So an asset pool oracle has two very distinct purposes. Purpose number one is to analyze the asset pool transaction ledger and to understand what are the transactions happening in the pool. What are the contributions? What are the collaterals? What are the withdrawals by distributors? What is the payment collection from the product and services consumer? And how are the payments tracking against the payment schedule? These 5 variables from the asset pool transaction ledger will allow the pool oracle to do a tremendous amount of anticipatory analysis in terms of, based on where the pool is, what is the risk-adjusted value of the pool at maturity. The pool oracle can then calculate the anticipated expenses, anticipated income, risk factor, and ultimately the risk-adjusted value. Now, we can launch a pool oracle, and the community can come around and say, you know what? I want to enhance and build a much more intelligent pool oracle, which takes into account geopolitical risk, or that takes into account climate and weather risk, or we want to be able to feed into the pool oracle attributes around population aging parameters, or the cost of the device dropping or increasing in the example of a device financing pool. And I want to be able to enhance this oracle and run my own. The notion here then is that the community can develop as many additional pool assessment variables by enhancing the oracle. And by doing that, we can see enormous intelligence, collective intelligence of the community to feed into not just the calculation of the risk-adjusted value, but also better pool design. And the true innovation here is that by having this pool oracle monitor every pool in a singularly uniform way, and allowing for pool-specific oracles to be built, which measure the pool performance backwards and anticipatory, we are essentially building a community-governed model of investment management that would fundamentally redefine financing models. So this is way bigger than just implementing an oracle. This is about learning to do community-based, community wisdom-based risk assessment models. And if you really think about it, you begin to see how that can scale beyond healthcare and will scale beyond healthcare, and how this could potentially disrupt the way so much of the traditional finance operates. Now, let's dive deeper into the asset pool index token. So every asset pool, APX, has a pool index token, PITx, X being the moniker for the pool and therefore for the token. The way the pool index token contract works is it's an ERC20 token, which is issued directly the moment somebody contributes assets to the pool. So if $1,000 worth of assets are in the pool, 1,000 PITx tokens exist. And if there's $1 million worth of assets in the pool, then there's 1 million PITx created. So PITx is generated when asset is contributed, and PITx is burned to redeem the asset. So if we have if somebody withdraws $100,000 worth of their assets from the pool, then 100,000 PITx would be burned along with the redemption step, which gives them their money back. So the PITx is sent to a distribution contract, which then burns the PITx and sends the assets back, the original assets plus the accrued interest plus any income share that they have earned for that token. So this is a key. For one thing, it's a key to depositing and withdrawing your assets. The key can be transferred to others for sure. And the key changes color or value as the pool performs better or worse, which gives you a very good way to track the pool performance. And if we end up with hundreds of pools, and I suspect we will as a community, the PITx comparison to PITy to PITz gives us a very quick way to understand and manage how pools are performing. And the calculation of PITx value is the risk-adjusted value the total pool risk-adjusted value divided by total number of PITx outstanding gives us the value of the PITx, which is represented in the PITx V moniker. There is a lot more analysis behind this, and we have some really smart people working on making sure that these formulas and these calculations stand up to the test of variability. But the general principle is sound, very sound, that the PITx token, in addition to being a redemption key, is also reflective of the current performance of the tool based on the empirical data coming from the pool transaction ledger, as well as the subjective data that the Oracle can combine with the empirical data to figure out what the redemption value of the token is if things stay the same at the end of the commitment period. So this is how the PITx works. So let's say that $1 is distributed from the pool asset. So the distribution occurs, meaning that $1 was taken from the pool to buy a device, for example. In that case, a distribution contract updates the Oracle with a distribution parameter, and that also creates a payment schedule, because every dollar that is taken out of the pool must be reflected back in terms of return schedule or payment schedule. So there is an equivalent, if you think of it as double entry bookkeeping, an exit of a dollar is compensated by a creation of a $1 plus payment schedule, because it's going to be that $1 taken out of the pool must return $1 plus some interest plus some income. So the payment schedule is the opposing entry for the dollar distributed. And that payment schedule is added to the ledger and to the Oracle as well. Now, as payments come into the pool, and all payments are received by the payment contract, those payments are received and evaluated. The Oracle is able to be immediately updated in terms of the distribution, the payment schedule, and the payment receipt. And it can do a series of calculations to immediately determine if we are tracking above or tracking behind. Let me give you a very tactical example. Let's say that $1 was distributed, and we now expect 12 10-cent payments for a total payment schedule of $1.20. So the $1 paid out from the pool should generate $1.20 in returns in terms of 12 payments. And that payment schedule is fed into the Oracle. And now the transaction ledger shows that 3 out of 7 payments were on time and 4 out of 7 payments were a day late, 2 days late, 3 days late. The Oracle has the ability to calculate the risk-adjusted value. Is this really $1.20, or has it dropped to $1.19 because we are seeing certain delays which indicate a pattern of growing risk? So the Oracle's function here is to adjust the RAV, the total pool risk-adjusted value, by computing such variables. But that's just the ledger data, right? What about geopolitical data? What about regulatory risk? What about legal risk? So the oracles can then be made smarter and smarter independently to allow for such risk to be factored in. And that's a function of the community. And the power of the community coming up with new oracles to calculate better ways to come up with alternative RAV of the pool will give the community incredible power and governance control over how pools are configured in the future and how pools are currently priced in terms of their current net asset value equivalent. So the notion here is the PITx not only is a redemption key, it's a continuously updated indication of pool performance. Now, if the pool risk calculation begins to show us that there is either a payment risk or a default risk or a collateral risk, that will immediately show up in the risk-adjusted pool value, which will then change the PITxV. And people can, at that point in time, make a decision on what they can do. If the redemption period is permitted, they can redeem. If they like what the pool is performing, they can decide to roll their assets for a longer period of time and accrue more interest. And in the end, the value of the PITx reflects not just the contributed assets and the anticipatory payment schedule, but it can also will show actually received payments, which means that as payments come in, the pool index token value grows, because out of the 10 payments or 12 payments we were expecting, 9 have already showed up. So we are already at 90 cents in terms of recovery, and we only have 30 cents outstanding. So those kind of factors will continuously update the PITx value. So the goal here is for PITx value to be updated in real time, no later than once a day, but preferably real time, based on the aggregation of the asset pool transaction ledger and the function of the oracle. So this is a very powerful construct, which I think brings a unique level of transparency to any asset pool. And instead of relying upon a quarterly statement from a money manager, or instead of relying upon an annual filing by a company to understand how your assets are doing in the hands of others, the decentralized vision says you see it in real time and you have choices to make as soon as you like or don't like the performance of the pool, and you have the ability to discount the value, your PITx token against future timescale value or in terms of risk value. So the idea of creating a PITx is rather simple. When asset pool parameters have been approved and the pool has been configured, the moment an asset is contributed to the contribution contract, a PITx is issued. The assets are locked into the asset pool and they start to accrue interest, and there is a payment schedule or an income calculation that gets applied for every asset distributed, and all that combined ends up in the calculation of the PITx. When you redeem the PITx, the redemption happens by sending the PITx to a distribution contract, which burns the PITx and takes the principal, the accrued interest, and any income share that has been accumulated so far, and distributes that to the PITx owner address. So in effect, the PITx is a mechanism through which the pool assets can be accessed, and it is a redemption right. So if you have the PITx, you have the right to redeem the original assets contributed, as well as any accrued interest and accrued income. Now, in the big scheme of things, the asset pool is one of the several components of the DAO. So the DAO, of course, is a community-run organization. So the community under which there are governance committee, community experts, and distributors. These roles we will discuss next week, but consider it as the community that governs and owns and operates and participates in the DAO. You have asset pools, which are funded by the community, which are governed by the oracles and pool tokens. And then last but not the least, you have the constitution, which defines how governance can and cannot happen, what governance schemes are permitted, and how governance schemes are implemented, and how to update them and how to manage them. And most importantly, the constitution also tells us what the pool's purposes can be, what type of pools will be permit, and what type of pools should the DAO not permit. This is a DAO designed to advance healthcare around the world. So the constitution calls for do no harm, always take care of the patient's needs, never ever finance a product or a service that can harm the patient, empower the physician, and so on. So we will talk about the constitution in an upcoming webinar. There is a lot to cover. The DAO has been thought through and explained in great detail in the white paper as well. But I'm going to continue to run a series of webinars to introduce you to the DAO construct, with the expectation that you as a community member, as the ultimate governor of the DAO, you will understand and ultimately manage and make this DAO a truly global solution for healthcare. And having proven it in healthcare, I expect that others will copy or will leverage this DAO in many other sectors. So the asset pool life cycle, I covered that a little bit earlier, is a pool proposal is submitted. It can be submitted by most anyone. Initial smart contract review tells us if the proposal is complete and meets the constitutional requirements. And if the contract score is not high enough or flags the need for committee review, then governance committee or expert review occurs, where they must vote on it to push it forward. The community voting is a step through which all the token holders, the governance token holders, vote and approve the pool. They must approve the set of parameters in this vote. If the parameters are not acceptable, it goes back to step one, because you cannot alter a single parameter. The pool is a package of parameters. The community accepts or declines them, which is why a committee review can help the proposer optimize and refine the parameters before the community votes on them. Once a pool is voted into creation, the parameters are fed into the pool contract, which activates a pool. The activation of the pool allows contribution of the assets which then generates a PITx automatically. The pool are used to distribute products through distributors. Distributors have a whole series of requirements and a smart contract for distribution that they must meet, including collateral and so on. The product distribution leads to all payments are required to be fed back into the payment contract, which is monitored by the Oracle. And then the Oracle is calculating the daily value of the PITx, which allows the PITx holder to redeem the principal, interest, and income. So this is the complete picture of an asset pool lifecycle. And what I didn't draw here that you can also add on is at certain point with the either automatically because the pool parameter calls for automatic liquidation or by community vote, the liquidation contract is triggered, which then takes all the assets and distributes them to the PITx token holders and closes out the PITx redemption contract. Now, in all of this, there is a role for the Solve token that we have designed that the DAO is using, because this is the most robust and simple and effective model that we could come up with. The first is that when the proposals are made for asset pool creation or distributor proposals, there is a mechanism by which the proposal can be submitted to a smart contract, but it requires a certain amount of Solve tokens to be staked. And if there are too many proposals there, some proposals can be boosted, and we put a limit of boosting to 10 proposals at a time. So the community is not overwhelmed with a tremendous amount of boosted proposals. The highest boosted proposals will get the committee review first. Also, the governance tokens are only obtainable through mining the Solve token. So in other words, proof of stake or staking Solve gives people the governance token and the governance voting rights. The pool collateral can be, and by default is in Solve tokens. And if the distributor does not have enough collateral, they have to deposit more before they can withdraw assets. And the pool payments, by and large, at least those pools that are being distributed by Solve.Care to the market, such as the consumer device financing, all accrue back in Solve token, which then converts them back to whichever coin is needed, stable coin or not. So these 4 functions of proposal and boosting proposals, mining for governance tokens, depositing pool collateral, and collecting pool payments are currently proposed to be done in the Solve token. This is not to say that other tokens won't be accepted in the future, but this is the launching framework for the DAO. Now, the pool will generate a well-governed pool, properly constructed, will not only pay interest, it will also generate income. To the degree it generates $1 in income or $1 million in income net of interest payments to the asset contributors, the proposal is for that income to be shared across these 5 functions. The bottom 2 functions are mandatory. There has to be a certain income attributed to the DAO treasury. That treasury then allows for functioning and payment of from the treasury to community experts and for other purposes of the DAO. There has to be a certain allocation towards taxes and administration and paying the community experts if there be such a need. And then there are the distributors who actually distribute the pool products and ensure collection of payments. There is the asset pool contributors who are putting the money in, who should get a piece of the income. And then there's certainly the governance committee, who also shares in the pool income. And the idea is that while the asset pool contributor has interest income, they should have an equal stake or a meaningful stake in the income of the pool beyond the interest, and they should be as engaged in the governance and the promotion and success of the asset pool beyond just collecting interest. So the proposal is approximately 1/3 of the income to go to the governance community and a little bit less going to the asset pool contributor since they already have a meaningful APY attached in terms of interest. The distributor having a meaningful interest in the income because they are the ones who are working with the end user, the doctor, the patient, and the other ones who are responsible for timely collection of payments. Even though the collateral is at risk, certainly we want distributor to have a meaningful interest in managing the risk. And then taxes, administration, community experts, and treasury contribution adds up to 100%. These parameters are default parameters. They are subject to community governance and you could change them. The community might vote to double the governance token holder component, and that would be well within the community's rights, as long as the pool can still perform successfully. It's a community's decision to decide how much of the income goes to whom. So having said all that, there are lots and lots of asset pools, right? The notion here is that in this model of an asset pool that is community governed, community approved, community funded, automatically measured, and easily demonstrated in terms of what is functioning, how its performance is, it makes sense to think about all kinds of different asset pools as possibilities. Not as necessarily to be done now, but certainly possibilities. So the one clear pool, there is a lot of conversation, a lot of work being done is around the idea of a consumer medical device financing. Essentially, the ability for doctor or physician to finance necessary remote monitoring devices that they need from a ongoing care and chronic disease management perspective, and to have a monthly recurring payment for that device lease or financing model. And there's a tremendous amount of work being done there. But there are other pools which can feed professional device and facility financing, who can do cash flow accounting and receivable lending, who can underwrite practice insurance risk pools, who can provide consumer supplemental insurance for specific disease types. You could even fund drug research and discovery, those are very, very large initiatives of the few. But as we see in the COVID-19 world, the centralized healthcare doesn't work as well as it should have worked. So why don't we look at going beyond small pools to very large pools? And this is going to be your job to figure out at what scale does the DAO want to offer these very advanced pool types. The point is, it's a community's purpose and function to decide what scale and size and purpose of the pool to launch. But this is just a way to get you started. This is a way for you to start thinking and start analyzing the pool types. And as an active governor of the community, it'll be your function to choose which pools you approve and which pools you deny. Let's talk a little bit now about a hypothetical illustrative pool that we have spent a lot of time creating a model. Now, this is not a 100% accurate data set, because there's no way to be 100% accurate at this stage, but it is a projection. It's a template, it's a pro forma. The notion here is to finance devices that cost on average about a little bit less than $100 to buy and to ship. And devices would be like a Bluetooth enabled blood pressure monitor, or a oximeter, or a glucose meter, as an example. What we did is we did some research to figure out what kind of a device cost it would be. So cost per device bought in bulk, what the shipping and handling costs are, what the breakage and loss prevention and insurance for the devices. And we end up with about a $92 device. We then looked at the market and said, what would the monthly lease revenue for this device would be? And it turns out to be around $15 per month, including certain capabilities to connect the device to a software, and the software to capture data from the device in a secure way and deliver it to the physician. In our world, that would be the global telehealth exchange. So the device plus a global telehealth exchange connection for the device yields a $15 a month payment. Let's imagine that 10% of the device payments are not made. This is very high, because typically if the physician is leasing the device, we expect that to be a much lower number, but let's use this as a baseline. Because remember, we want to be able to have the Oracle measure the performance against a baseline. So let's use baseline as 10%, which means that the device would yield an annual revenue of $162 adjusted for defaults. And let's assume that the distribution costs of signing these leases and delivering the device and tracking the utilization of the device and so on is about 22%. And this is also based on actual negotiations. So that leaves the pool a net revenue of $126 for every $92 lent. And that would then get distributed as $11 of interest payments at 12% APY, $11.09 would be paid out by the pool to those who contributed their assets to the pool. $92.40 is the return of principal, and that leaves the pool with a net income per device of $22.87, assuming that that the default rates are 10%. If the default rate is 9%, $22.87 might become $23. The point is the Oracle calculates that on a regular basis so that one can say, against this baseline, how is the PITxV doing? And that is the measure we are after. We are after an extremely accurate, community governed, community monitored measure of pool performance that does not require any more complexity than knowing that the PITxV is above or below the base par value, if you will. We took that model and we applied a 500,000 device financing framework and estimate. And this is based on physician groups that we are talking to today. And what it ends up being is the pool would be a $46 million pool. It would generate gross revenue of 81 million, pay out distribution costs of 17.8 million for those who actually will get these devices shipped and deployed at the patient physician office, leaving the pool a net revenue of 63 million against a $46 million contribution. And after returning the $46 million and $200,000 of the principal and paying $5.54 million of 12% APY to the contributors, the pool would have a net income of 11,436,000, which would then be shared across asset contributors. They would get additional 3.2 million. So their return goes from 12% APY plus 3.2 million. It certainly pushes them close to 20% return. The distributors get 2.2 million for keeping the default rate at 10%. If the default rate is at 9, they get an increased share, obviously. And the governance token holders, a community, get a $3.7 million distribution from that pool for being the good governors of this, leaving 2.1 million in for taxes administration, community, and the treasury. All of this gets deposited in the DAO treasury from where all the legal, regulatory, administrative costs are paid. And if those costs are lower, then they get distributed to the other three parties. So this is an example of how an asset pool would operate in a fully governed pool governance model of community and the Oracle, and how you could take that model and apply it to all kinds of projects. And this is just a financing model. There's also a underwriting model along the same lines. But the point is that community is free to use this as a template to think about how this pool should be configured and what the pool should do. Now, what this really, all that part is cool, but this is the best part. What I really like about the model that we have developed for asset pool governance is this. The PITx reflects every single hour or every single minute or every day, depending on how frequently the Oracle updates, the value which reflects the performance. So on day 0, the moment the first dollar is lent out, there is a certain payment schedule that creates a accretive value to the pool. So $1 contributed, PITx is worth $1. The moment the dollar is lent out, there is a certain PITx value increase. The lending of the dollar creates a payment schedule, which has now an anticipated income. And as the month and the weeks and the months progress, the actual principal returns and payments and defaults continue to show up in the PITx value increase. And if everything tracks according to formula, at the end of the year, the PITxV should be 116 in this formula, where the assumptions are that we have basically funded 3 devices, and we are paying out 12% interest from the pool. The pool is, the income that is coming into the pool is $15 per device per month. The lease default rate is 10%. The distributors get 22% of the post-default revenue, and the expenses are 5%. In that model, you would see on a regular basis the accrued interest and earned income, or the pool income, and the share of the PITx. And that one single value, PITxV in the right column, is a simple indicator of how the pool is performing and whether it is meeting or exceeding expectations. So in a nutshell, we are focused on healthcare. We always will be at Solve.Care, and the DAO community for DeFi for DAO has enormous opportunities to finance healthcare projects, whether they are proposed by Solve.Care or proposed by a distributor in Vietnam or a community member in China. The pool community, the DAO community will decide which projects to approve. So it's a huge sector, and there is ample opportunity for a very, very, very large and effective DAO to exist and to succeed. But it does not prohibit us from allowing this DAO to function in other sectors as well. The model fundamentally is not sector specific, but the constitution requires that the DAO be focused on the best interest of the patient and the doctor. But if we want to, as a community, you choose to allow other types of projects to come in or bifurcate and create a DAO for non-healthcare on the same model, that should not be terribly difficult. So with that said, I've given you a complete picture of, I hope a complete picture of how asset pools are conceived, evaluated, approved, contributed, distributed, payments are collected, risk is measured, and ultimately how they are redeemed. The entire model is implemented through a series of schemes. Those schemes are a set of smart contracts interlinked and with appropriate configuration parameters. And this is being the effort and the innovation of the founding committee, supported by Solve.Care and other members of the team, to build a truly scalable, real-world DAO that the community can safely operate, govern, and expand. And I will share with you tremendous amount of information about all the other elements of the DAO, the community governance model, the constitution, and everything else that goes into ensuring that this DAO can operate and scale. But today, the focus was to get you to understand the asset pools, the asset pool index token, and the process flow that goes behind the life cycle of the asset pool, if you will. Welcome your thoughts and questions. Would love to hear back from the community what we might do to improve the DAO, because ultimately it's your DAO, and this DAO will only come into life when the community governance is in effect. I want to make this point very clearly, that the DAO design and implementation is one thing, but the actual operation of the DAO will only happen when the community is in charge of this DAO. We are not going to allow the DAO to operate unless the community has taken hold of it and owns it. So this is the phase we are in currently, is the design, development, and improvement of the DAO framework, and coming up with a very powerful protocol that allows for merit-based project lending, that allows for real-life project lending, and that allows for real-time project monitoring. Once that protocol is finished, then it is your job to turn this DAO into a global phenomenon. I appreciate your time and efforts, as always, to support both the Solve community, the Solve token holders, as well as the Solve.Care team. Very much appreciate all your support over the years. And I look forward to talking to you again next week as we dive into the other elements of the DAO. Have a great weekend, everyone.